Hello there, I'm Vicky from the Comms Marketing and Engagement team, and welcome to the Handover, the podcast for all staff at NCH&C. This podcast is created to be an accessible platform for having a conversation with all of our colleagues. This is a special edition of the Handover to celebrate Allied Health Professionals Day, which is held every year on the 14th of October. I'll hand over to Lydia now, who attended our first ever Allied Health Professionals conference earlier in the year.
Hi, it's Lydia from the comms team, and in this segment of the podcast, we join staff for NCH&C's first ever Allied Health Professional Conference, which took place in March. The theme for this year's conference was Bringing AHPs Together, and it followed valuable insights that were gathered from the AHP listening events in 2023. One of the biggest things that we learned was that many AHPs across NCH&C were unaware of the full range of AHP colleagues within our trust. So, Kate decided to create an AHP forum to enhance connections and collaboration.
Hello, I'm Kate Ponting. I am the Director of Place for Norwich, and we're here today at Deer Football Club at the AHP conference, which has a theme of bringing AHPs together. AHPs in NCH&C are a wide and diverse group of staff, and what's really important is that we're able to find links with each other and support patient care and outcomes in the best way that we can. We've had speakers from NHS England talking about the national strategy for AHPs, and also we have speakers who are speaking about the regional strategy for AHPs from NHS-E. Also, we've had David Wiley, who is a podiatrist by background, who has developed a workforce planning model to support improved capacity and productivity in AHPs in many services. And some of the subjects that he's talked about include the use of data and how do we as AHPs use data to the best possible effect.
I'm Janice St John Matthews, Senior AHP Advisor, so Senior Allied Health Professions Advisor. I've come from NHS England today, specifically the Office of the Chief AHP Officer. So Professor Suzanne Rastrict, OBE, sends her regards today, so she sent me as her representative. I've actually come all the way because I live in South Wales, but our offices are based in London and Leeds, but I've come all the way to absolutely beautiful Norfolk and Norwich, so was delighted when the invite came in, especially because I've got some links in the area as well.
What is something that you will take away from today?
So I think it's really, really helpful for us in the central team to come and see what's happening with these just incredible allied health professions, and to see the services that they're delivering and hear about the really impactful work that they're having. Sometimes as allied health professions we're not great at showcasing our work, and also we're a little bit hidden in plain sight. So altogether there's 14 professions, and today I've met the dietetics team, the speech and language, the physiotherapy, podiatry and occupational therapy teams, who just doing some fantastic stuff across the whole of the county actually, and they're just sharing all their best practice with me as well, which is really, really helpful with my national hat on.
After a busy morning, everybody stopped for lunch, and Laura and I approached some staff to talk about their experience.
The first speaker, Janice. They're quite inspiring to know what's going on at the top, the strategic, and how that influences what we do on the ground. So I find that very interesting, quite inspiring. But this chap, David Wiley, I'm not good with names. Totally interesting, really fascinating. I've been on one before COVID times. He mentioned Kate McElmis, who he worked with. I've been on one of her trainings, and that blew my mind at the time and completely transformed how I worked in triage. So it's very similar, how he was talking, and I'm really looking forward to this afternoon.
I think he makes it sound, his presentation was brilliant. I think for me, he just makes it sound so easy, and I think, if you know, and like you said, Kath, about being kind of inspirational, I always go away from things like this with a head full of ideas, and wow, wouldn't it be amazing to kind of like try this with our workforce and start to think about really drilling into sort of capacity and what we could do differently and how we could work more effectively. And you know, days like this when we can all kind of come together and share our ideas. There's so much good stuff going across the trust, and I think it's right we don't shout about the really good things that we do, because it becomes part of our day-to-day stuff. It's business as usual for us. But I think, you know, certainly like the research element from this morning was really interesting. Something that, you know, I'd love to do is set up a bit of a research, and Lynn and I have talked about this, set up a bit of a kind of research forum for NCH&C to really get that grassroots stuff going. But I think now it feels like a real pivotal time with the changes to NHS&C, the government, you know, the fact that for AHPs are not always represented at ICB level. I think it's really important that we don't lose our voice, and I think shouting about the work that we do and evidencing is another really big thing that's come out of today. Using the data, evidencing the good work that we do, and trying to maintain that voice moving forwards, I think is going to be really important.
I think also what's important is like, it's the so what next, isn't it? Because often you come on a day like this and it sounds great because everyone sounds so motivated, and then you go back to work. So how do you keep that alive, and where do we take some of this now? Because I think particularly around the workforce planning and data, we really need to follow that up, don't we? And maybe work with another team, see podiatrists, use the sort of framework. So I think we have to go away with some actions after today to make it all worthwhile.
It did resonate what he said about PDRs as well, sadly. That it's just a tick box exercise, and I felt that for a long time. So that's given me food for thought.
Yeah, and I guess we all have our responsibility to make the ones that people we work with, make them as good as we can. But time is often an issue for people, isn't it?
Yeah.
So, that's something again we can look at.
And I think supporting the managers, that was quite a sort of a poignant part in the presentation about the support for managers. And actually we've got some amazing managers out there, but it's knowing what resources are available. So, you know, kind of like team leads coming to me and saying, wow, you know, wouldn't it be great to be able to access this data and stuff? But people, we have those resources. I think it's about giving the support to managers to be able to go back to their services and know how they can implement, you know, some of these things. And that's quite inspiring, I think, because from my level, you know, workforce, you guys know your services an awful lot better than I do. So I think that's a really good place to start, is looking at individual services and working with the managers to empower them to go and look at the data if they're not doing already, and what does that show, and how can we start to look at efficiency and stuff like that. Yeah, my head's full of ideas.
From a trust perspective, how we show how we value all our AHPs, so that things like PDRs are meaningful, and they're meaningful to you. So I think we can learn a lot.
And from my perspective, what was really shouldn't be surprising, because obviously I'm very much wanting to really promote education and research, is that it really came out how important education and research are.
His point there was so interesting, wasn't it? Yeah. He'd rather lose a member of staff than not educate 199.
And I think we perhaps bucked the trend in terms of our educational offer, in that he was talking very much about, you know, it's the first thing that goes. I think it's really strong in NCH&C. It's not the first thing that goes. We really value it. Of course, it's really difficult and pressurised to release people, you know, from their day-to-day job. But it's almost a false economy by not doing that, you know, because you need to invest in people. And I think it was really encouraging that it came out in most of the keynote speakers this morning.
Hi, I'm Chris Gilman. I'm team leader for community podiatry. I've worked for the Trust for 25 years, and this is the first time I've been on an AHP day like today. I'm really enjoying it so far. All the staff from my team all seem to be really enjoying it, and it's working out very well to network with a lot more AHPs. I suppose several people have come to me and talked about the work that we did with David Wiley last year. So it's been quite good. I've networked with people who want to know more about how our situation worked with David last year, and that I think will make a difference to several other teams.
For NCH&C's first ever AHP conference, this day was truly amazing. It was great to witness so many AHPs coming together, connecting, networking, and sharing ideas. I want to thank everybody that took the time to speak to us and thank all AHPs for the incredible work that you do.
Thank you, Lydia. More information about AHPs and the work they do at NCH&C, career opportunities and the latest AHP news can be found on the AHP section of The Loop. There are also links to all of this information on the webpage for this podcast. Thanks for tuning in to another episode of The Handover. Don't forget to send us your ideas and thoughts about The Handover, and if you have an idea for a feature or would like to host a segment, then get in touch. Join us again for The Handover soon. Bye for now.